employees in the workplace. And so, and then as Heidi mentioned, this is a much shorter presentation than we gave last time because we really want it to be more conversational and hear what you all are hearing in your end and what you're curious to learn more about. So with that, I will go ahead and just introduce the rest of the folks from the state that have been so generous to offer their time. And so you will hear from all of these folks during the Q&A session, but Trudy Raymundo is the head of external affairs for the COVID-19 response at the California Department of Public Health and has a wealth of knowledge and has been in the public health world for many, many years. So excited to have her back. Vaughn Boyinger is new to the team here, but is a Senior Deputy Labor Commissioner at the state. So thank you for joining, Vaughn. And then Erika Monterroza is also joining us again from last time, and she's the Communications Deputy Director at the Department of Industrial Relations. And she's been great enough to invite Brandon Hart from the Division of Occupational Safety and Health. And he's the program manager overseeing communications and strategic planning. So thank you, Brandon, for joining us today as well. And again, these are the subject matter experts, and you'll be hearing from them in a bit once we get into the Q&A portion. So just to give everybody a quick update on where we stand from a vaccination standpoint, I know, if you're like me, you're checking these numbers every day. I know some people aren't as close to it, but just to give everybody a sense of where we're standing, we're still the state's receiving a healthy number of doses per week in the 2 million range. From a vaccination standpoint, we're at about 42.5 million vaccines administered in California. To give you a sense of that scale, that's about 17 million more than the next closest state, which is Texas. So from a volume standpoint, certainly leading the country in that respect. More than 20 million people have been fully vaccinated. Another 3+ are partially vaccinated. Obviously, this includes ages 12+ now that the eligibility has expanded a bit. And within those numbers, so about that basically comes out to almost exactly 70% of people ages 12 and older have been at least partially vaccinated. So statewide, we are a bit ahead of the state average, or sorry, the nationwide average, and have kind of hit that 70% mark that President Biden had set out for the 4th of July goal. And so we've met that, but of course, there's still a lot of work to do, knowing that specific counties and a lot of communities are heavily under-vaccinated. So while the overall state picture looks pretty decent, when you get down to the county and community level, there's quite a bit of work to be done still. So we're averaging about 55,000 doses a day, which again, looking at the rest of the states in the country is still leading that pace, but it's dropped significantly just as we've gone further along. So doing a lot of things to try to keep those numbers at least flat in the coming weeks and see where we can continue to add doses in communities that are a bit underperforming.
Willie, can I interrupt you? Do you have a kind of a broad stroke of some of those communities that are what you are calling underperforming?
Yeah, I think broadly speaking, without rattling off the list of them, and Trudy, feel free to chime in. But obviously, we're seeing some of the more rural counties are lagging a bit. Generally speaking, Inland Empire, Sierras, and then Northern California, so north of the Bay Area and Sacramento, tend to be where we're seeing some rates lag. But in that same respect, and Heidi, you mentioned it, is even some more urban areas, places like Alameda, obviously LA County with a large population. There's now zip codes in a lot of counties that are underperforming. So it's really much more granular. Unfortunately, there's not a broad stroke to say what's doing well and what's doing not. But we're trying at this point getting down to the community level to see really from the zip code or census tract level where we can make the most impact. But broadly speaking, I will say probably some of those regions as a whole. And just a quick reminder before we get into some of the other details, as I mentioned earlier, so 12 and up, all Californians are now eligible to receive the vaccine. Obviously, this is critical as we get closer to that back to school timeframe. So it's crazy to think about, but for a lot of folks, in order for children 12 and up to be complete their vaccination series prior to going back to school. That actually means beginning to get vaccinated now with Pfizer, knowing that that's how long the 2-dose series takes to complete. So important to think about that as we get closer to the fall. My Turn is still the place to go to book appointments, although many sites have walk-up capabilities now. My Turn, actually in recent weeks, we've added a walk-up location feature to it. So if you're curious where in your county you can find walk-up locations, that information is available, as well as the in-language support. So we have our COVID-19 hotline there, which includes extensive support for over 250 different languages. So want to make sure that folks have that information to share. And then the CDC's Vaccine Finder tool is still a great resource. It obviously includes all the federal pharmacies that have been administering doses across the state as well. And so again, these are just kind of the high level tools and that want to make sure everyone has access to moving forward. One program I did want to plug that is also new since we spoke last, and I'm sure some of you have heard of the lottery, the various lotteries that happened over the last several weeks, and saw those various incentives. But we do have a few that are still ongoing. So the $50 incentive cards, these are still active. This is obviously a while supplies last type of program, but the supplies are still available. Anyone ages 12 and over who completes their vaccine gets access to a $50 card. You have to redeem that card in a certain amount of time in order to receive either the $50 virtual card or one of the grocery cards from Kroger or Albertsons. We expect these will probably still be available for probably at least the next week or so, but they are starting to run out, obviously, since they've been in effect now for nearly 2 months. So that is still available. And then also Six Flags, we're giving away Six Flags tickets to anybody who just gets their first dose at a participating clinic. So there's a link there to the list of clinics in case people are curious, and just kind of another way to sort of keep people engaged and entice them to get vaccinated. So wanted to just call a few of those out, knowing that those are still active. And of course, at the county level, at the city level, there's a lot of other incentives that are happening at the local level. These are just the state-sponsored ones, so wanted to include this information here. And then before I pass it over to Stephen for his section, I just wanted to highlight, and we expect to go into this in more detail during the Q&A, because I know this is probably where the bulk of questions will be, but just wanted to highlight some of the employer-related resources and information since things have changed and shifted so much in the last couple of weeks. So just a reminder on like workplace COVID-19 vaccination regulations. Obviously, as far as vaccines for employees, a reminder that the policies cannot discriminate, based on any sort of protected characteristic, disability, or religion, and employers need to provide a reasonable accommodation for these types of things if they decide not to be vaccinated. Employers may ask for proof of vaccination, but they need to maintain that as a confidential record, or can ask for self-attestation from their workforce. There's a link to more detailed guidance there from the Department of Fair Employment and Housing, as well as in the appendix of the deck. For best practices standpoint, and I'm sure this will overlap a bit for what Stephen's going to discuss as well, but really we've seen how important it is for employers to encourage vaccination and to some extent, and this is what we at the state have been trying to provide, is opportunities and resources for on-site workplace vaccination. I'll talk a little bit about this on the next slide. Providing paid time off for employees who choose to get vaccinated. It is also a huge benefit that employers have the ability to do, and we encourage them to do, and the data has shown that employers who do offer to do so see a much larger rate of their workforce deciding to get vaccinated, knowing that they have that time off. Cal OSHA does not require employers to provide vaccinations, but they do require effective training for supervisors and workers on both how to access testing and vaccines and the overall effectiveness of vaccines to protect against COVID. So the rest of the team here is available to speak to that a bit more. But I did want to touch on workplace vaccination support in particular. This is something that we've worked on over the last month and a half since we spoke last, and have really seen some good traction here. We have a state resource now, and there's a link here online for employers who are curious and interested in requesting on-site support for vaccine clinics. So this page includes information of the different models that the state provides in terms of support, how to submit a mobile request clinic, and then just other best practices for educating your employees and providing them the proper resources. I do want to just note for this particular resource, it is really meant for employers that have a need for more than 100 vaccinations per day. So obviously it's difficult at the state level to provide a mobile resource for every single employer. And so we encourage, if you do, you yourself, or you know anybody you work with, any of the folks you work with have this much of a need, please point them our way. Or we also encourage employers to pool if they're in the same city or the same county. We've seen some really effective partnerships with either schools or churches to get together to be able to get up to this 100 dose mark. And so I encourage anyone who's interested to go to this website, fill out the form, and somebody at the state will usually get back within 2 to 3 business days with more information on how to proceed.
Well, Willie, I have another tiny clarifying question on that. So like we have a business improvement district, and if they can get the 100 doses, then they could get together and maybe request one. Is that right? Like, so
Correct.
even if they're little tiny small employs 5 people, if there's 20 businesses on the street, they can do something.
Correct. As long as we have, as long as we have one location and one point of contact who's going to be the one to help sort of convene all those groups, then we're obviously more than happy to do it. That's the perfect example of sort of pooling together various employers. So yes.
Or even one of our members could do it at their site, right? And they can bring all their clients with all their staff members.
Yes.
Right?
I love it. Yeah.
Okay.
If anyone is interested and willing to take that on, we have a team of folks here on the CDPH side that will be happy to speak with you. So feel free to look into that. And in addition, just before I wrap up, the Vaccinate All 58 newsletter that our team puts out weekly is a great way to just stay in the loop around what's happening, all things vaccine related. So there's a link to sign up here. And as well, this is a collection of resources from the whole state team that you see here on the webinar. There's a lot of great resources here from everything from Cal OSHA to CDPH, to our labor agency. There's some communications materials here as well. So these are kind of the latest and greatest resources, and I encourage you all to browse these if you have questions, because there's a wealth of information here. So with that, I'm gonna stop sharing my screen and I believe hand it over to Stephen, who's gonna talk next.
Great. Well, first of all, thank you so much to the Cameo team for giving me the opportunity to be here today. I'm not sure if you're seeing slides or you're seeing a bunch of, there you go. You should see a cover slide, is that right? Perfect. You saw my messy desktop instead. My name is Stephen Massey. I am not based in California, but I am a California to Oregon transplant. So it's great to be back among friends here, and really appreciate the opportunity to speak with this network of small business accelerators and engagers, folks who are really supporting the small business response. The Health Action Alliance really is intended to help unlock the power of business to help accelerate the COVID response and strengthen vaccine acceptance and help rebuild public health. And you'll see lots of big companies that we work with here on your screen, but we also work with thousands of small businesses all across the country. And we're really informed by top experts in public health communications and business management, including the Ad Council, Business Roundtable, CDC, and others. I think, we all know it's been a really devastating year, and whoops, sorry about that. I am having trouble navigating my screen here. I'm gonna stop share. Whoops, let me try this one more time. Still not working, is it?
It's not on. I can share it on my end if you want me to pull it up. I can look it up.
Yeah, I apologize. I'm not sure why it keeps freezing on me here, but if you don't mind, Liza, that'd be great.
Okay, let me look for it. One moment.
And I might be able to even just quickly talk through this. But it's obviously been a devastating year in terms of lives lost and the impact on small businesses, with roughly a third of all small businesses having to close during the pandemic. I think what we know is that there are really specific things that small businesses can do to help strengthen our response and get us out of on a better track. And we like to think of on the next slide, there are roughly five things that small businesses can do. Sorry, Liza, next slide. Keep going. I'm just going to skip forward. And many of these things have already been shared. So first is to remove barriers to vaccination and just make it easier for employees and workers to get vaccinated when it's their turn. You can also educate employees and workers about the safety and efficacy of vaccines and encouraging them to get vaccinated. Proactively engage workforce populations that may have unique questions or concerns, and consider vaccines incentives for customers and employees. I'm going to talk about each one of these things in a minute, but want to share on the next slide that we have a small business guide that's available on our website, along with a whole range of tools for small businesses, all available for free at healthaction.org, that will help any small business in your network build a vaccine policy for their place of business, create a communications plan, talk to their employees, and work with their public health department to organize an on-site or near-site vaccination clinic. And again, everything that I'm sharing is available at healthaction.org. The previous speaker highlighted on the next slide many of the things that you can do to remove barriers to vaccination, like offering paid time off, paid leave for recovery. We know that these things work. They're also free for most small businesses because the paid leave tax credit that's part of the American Rescue Plan will reimburse small and medium-sized businesses with fewer than 500 employees. They'll reimburse them for paid time off for employees to get themselves and their kids vaccinated. So other things that you can do is to consider offering covering out-of-pocket expenses associated with vaccination, like transportation and childcare, or providing internet access or language support, particularly in areas of the state where there are higher rates of non-English speakers, or where internet access may be a barrier. In addition to removing barriers to vaccination, next slide, please, Liza. We know that people are more likely to get vaccinated if their employers encourage it and provide paid time off. This is the results of the most recent Kaiser Family Foundation Vaccine Monitor, which shows that people who are vaccinated, that's the green lines, 75% of all people who are currently vaccinated in the United States, well, their employer provided them paid time off to do so, and 73% of them received encouragement from their employer. You can compare that to the blue lines, people who are not vaccinated, and lo and behold, people are much less likely to work for companies that provide time off or encouragement. So we know that encouraging and time off will make a difference and considerably strengthen vaccination rates among employers. Next slide. We also know that employers can help motivate cautious employees through convenience and modest incentives. So among people who are still undecided about vaccines, they say that they would be more likely to get vaccinated if their employer arranged for an on-site vaccination, offered a modest $50 incentive, or provided PTO to get vaccinated and recover. So for many people, including many people who are still unvaccinated, these types of strategies really can move the needle. Next slide. Education is still really important. And there's a lot of ways that businesses, large and small, are educating workers about the safety and benefits of vaccines and why vaccines may be something that they would want to consider. We've provided on our website lots of great tools and resources to help you communicate directly with employees, but also know that every person that has questions is a unique story and a unique set of questions. And so we really encourage every small business owner to approach those conversations with empathy and really listen to those unique concerns and connect workers to trusted sources who can help dispel myths and educate about vaccines. Next slide. There are 6 key messages that we have focus group tested and that we know generally work for employees. There are specific messages for key populations that you'll also find on our website, including Hispanic and African American employees, also for rural or more conservative audiences. The bottom line message that we know that are working right now is that COVID vaccines can help us all get back to the things we love, those moments of connection that we've missed with our family and friends, getting back to business, getting back to work. Vaccines are safe and effective. Of course, they protect those yourself and those you love. And it's important to communicate that folks shouldn't delay. There are millions of Americans who intend to get vaccinated, but don't seem like they're in much of a rush to do so. And in order for us to build community immunity, especially in the context of a surging Delta variant, it's important for everyone to get fully vaccinated as soon as they can. The question we get often, of course, from workers is which vaccine should you get? We encourage you to get the one that's offered. They've all been authorized by the FDA and they're all recommended by CDC. COVID vaccines provide hope, but in some places, and I know there are parts of California where local jurisdictions are reconsidering mask guidance, it might make sense to continue wearing masks and distancing, particularly for those who are unvaccinated or for whose vaccine status is unknown. And then finally, it's okay to have questions. Many Americans still have questions about vaccines. Our job is to not try to force an answer or convince them, but instead to make sure that they're connected to trusted sources that can help answer the questions that they might have. In addition to sharing facts, it's important to just engage and support disproportionately impacted populations. This includes not only Black, Hispanic, and other communities of color that have been disproportionately impacted, but also rural and conservative populations that have more questions and have been more reluctant to get vaccinated. It's important to understand the unique challenges of these groups, as well as to create a safe and supportive workplace culture for those who choose not to get vaccinated. Additionally, we know that vaccine incentives are working for customers, and many small businesses have been considering or implementing really promising incentives that not only boost their brand, but also encourage vaccination. In fact, 63% of consumers who've received a vaccine said that they're likely to take advantage of rewards from local retailers. And 41% of consumers say that they feel like incentives would make them feel more favorably toward a brand. And then kind of additional tips that I think many small businesses are asking themselves now is, what are some other things that we can do to make sure that we're navigating safer workplace returns or operating in a safe way? Well, vaccines are really front and center and should be central to your workplace return strategy, but it's important to remain flexible and acknowledge the unknown. Also to monitor worker needs, both physical and emotional, as well as to collaborate and communicate really openly with employees to make sure that you put employee health and safety front and center. Guys, I think I'm going to stop there with the slides and just close with one last recommendation for folks. And that is that the CDC and the American Academy of Pediatrics now recommend that kids 12 and older get vaccinated. Of course, the FDA now says that all adolescents 12 and older are eligible for vaccination. And just 30% of our adolescents right now are fully vaccinated. That's a real challenge heading into the school year. And so we're more than 20 national business groups are calling on employers to help workers, working parents that want to get their kids vaccinated, help them do so by offering some flexible scheduling or time off. So that's just an additional strategy that small businesses should consider. Getting everyone vaccinated, including kids who are eligible, will strengthen our immunity and really help us turn the tide against COVID.
Stephen, I'm going to jump in here for 1 second, and because I did see your PowerPoint and you had some really good examples of the ways that businesses were offering incentives to consumers. And I think this is something I was like, oh, that makes total sense.
Yeah.
But this is something our members can help their clients do. So could you mind giving us some of those examples?
Sure. Liza, I may need you to put those back up.
Yeah.
Thanks.
I can't remember what numbers they were.
Yeah, I think you were right after this. There you go. So here's just a few case studies of small businesses that we've been working with around the country and who submitted some of their actions. One is a company called MKE or Up and Down Milwaukee, which is kind of an arcade. They're offering 20 free game tokens to anyone who's vaccinated. I assume most folks on this call have heard of a much larger company called Krispy Kreme that's offering a free donut to anyone who's vaccinated through the end of the year. So this is one type of incentive that small businesses may consider for customers. A Billings-based pharmacy, Pharma 406, is partnering with a local coffee chain. When you get vaccinated at their pharmacy, you get a free cup of coffee. Oak and Real, it's a Detroit-based restaurant. They're offering through the end of the year 50% off dining for all vaccinated customers. Just have to show your vaccine card to qualify. And then Florida Craft, which is, I believe it's in Florida, it's a small floral business. They have held a small vaccine clinic for their workers, and they're also providing $50 incentives for employees that get vaccinated.
To me, those I think are all really cool examples of stuff that people can pass on to their clients, right?
Yeah, and there's a lot of other great examples at healthaction.org, which is our website. There you'll find under the resources tab, a whole section we built out for small businesses that include tip sheets, videos, key messages, slides, and other tools that will help small businesses support workers and share facts about vaccines. We also include lots of kind of sample communications tools, as well as really detailed guidance around safer reopening. I should note that on Monday, we're hosting a big event with the CDC director and the president of the American Academy of Pediatrics around childhood vaccinations. That's on Monday from 2 to 3 Eastern time, so 11 a.m. Here in the West. And anybody can join that event and just learn more about ways that companies can support workers who might want to vaccinate their kids.
Great. Well, great. Let's stop sharing screens and open it up to all of you all for questions. I know we've got a couple of questions and we have, but who wants to go first? Unmute yourself. And what have your clients been asking you? What have they been wanting to know?
I have a question. Sorry if you can barely hear me. Is there any guidance toward, I know it's very employee focused, but is there any guidance toward actual customers or consumers in terms of asking or requiring masks?
Willie, someone from your team want to take that? Like, so what do they do? What can they require their customers to wear masks? How do you deal with a customer who may not be willing to comply? All that kind of stuff.
Let's see if Trudy wants to chime in on that. I feel like maybe you would.
Of course. So I think since the last time we had all spoken in May, hopefully you all have seen that CDPH has actually put out new masking guidance, and it actually does cover what businesses should be looking to do in regards to masking, especially for their customers. So our masking guidance is really, number one, we really tried to be mindful about aligning with then current CDC guidance. It's a masking guidance that we really tried to focus on both requirements and recommendations for certain sectors and certain settings. So there's a couple of areas where we've indicated that masking is required in all indoor settings, irrespective of vaccination status. So they are things like public transit, and that actually is coming from the feds, although I have not seen the update lately, but I know CDC was looking to update that order around masking within public transit to say that any outdoor spaces, so any outdoor areas in like bus terminals and things like that, the masking would not be required, but masking is absolutely still required in public transit and public transit hubs, which means airports, bus terminals, and those kinds of things. We also require masking, again, of everybody in settings that are specific to healthcare or long-term care facilities, in K-12 settings, school settings, and other youth settings. We require masking of everybody in homeless shelters, mass care and shelters, and cooling shelters, as well as we require masking in correctional facilities. In the other areas where we are requiring masking is really masking in indoor public spaces where you really wouldn't know what the vaccine status of folks are. And the reason being is I think we've always known that indoor settings are definitely always much riskier than outdoor settings. And when you're talking about public settings, you really don't have the ability to know the vaccine status of everybody there. And so we really wanted to be mindful of continuing some preventative measures and making sure that we are employing preventative measures, especially in areas where you may run into kids that are under 12 or those that are immunocompromised. So it does still require masking for unvaccinated customers in indoor settings. And it would be things like restaurants, retail, movie theaters, malls, even government offices where the public may come into those government offices. And the one thing I do want to highlight, which I think is most important for businesses, is that we provide businesses a variety of options on how to do that, what we call vaccine verification. So they can actually employ a kind of more proactive vaccine verification process where they may actually actively ask what the vaccine status is of customers walking into their facilities. They can use kind of what we're calling a self-attestation model. So it could be, a business putting up kind of a big sign or posting right at the entrance of their facility where they simply indicate what the requirement is for unvaccinated individuals going into the facility, and the simple act of somebody entering the facility without a mask. Essentially what that means is they are self-attesting to the fact that they are fully vaccinated. Or businesses, if they want to really look at being the most protective, they absolutely have the ability to require masking of every customer that walks in, irrespective of vaccine status. So, I really encourage folks to take a look at that masking guidance, but we really try to be mindful of providing businesses a couple of options on how to employ that vaccine verification process for their customers.
And how worried are people, and what are sort of the plans that are being put in place? And how does, that 70% number across the state weigh when we're talking about like the upcoming Delta variant and the possible surge, what's planning, or what should businesses think about?
I think really, the reason I really appreciate these presentations and these conversations, I think from the public health side, for us, the way we're really going to get out of this pandemic, even with the variants, is through vaccination. Plain and simple. It is really through vaccination. But with that being said, we are very much closely monitoring what is happening with the variants. We've seen, I think somebody had alluded to, I think you may have alluded to, we are starting to see a rise in our cases over the past couple of weeks. We are starting to see, I think we are 3 weeks into seeing increases even in our emergency department admissions and ICU admissions for COVID-related illness. And so we are starting to see some doubling and tripling. And I know doubling and tripling, when I say that, it sounds a little alarming, but you have to understand that we were starting at very low numbers. But it is definitely something to be mindful of. We're really looking to see especially how many of those that are hospitalized are actually ones that were vaccinated, although absolutely the largest number of COVID illnesses that we are seeing are in those that are unvaccinated. So we're looking at that. We're looking to see how well the vaccines are continuing to protect us from the variety of variants. And we're really looking to see, moving forward, what the numbers are going to look like, what our masking recommendations may end up being if we continue to see cases. We're really now using the CDC tracker. I think Stephen had put it in one of his slides. The CDC has a really great site. It's called a data tracker. It can give you kind of county by county where certain counties are now in terms of their overall rates. And whether or not they're starting to move into what we're calling kind of moderate, substantial, or high according to the CDC in terms of case rates. But I think masking will continue to probably be the most important mitigation measure. It's the least intrusive. It really is a really simple way to protect yourself, to protect those that are continue to be unvaccinated as a result of either vaccine hesitancy or because of medical conditions or whatever the case is right now. But we are watching that very closely. The one thing I do want to say, even just from an epi standpoint, I think we knew when we reopened California that we would see a slight increase in cases. I think that was just a natural progression. That's just something that you see as part of this pandemic. But we are, to that end, we're also watching to see how the variants are continuing to move across the state.
Yeah, Amanda says in the chat that they've had a few clients who are concerned about the hospitalization rates going up, and they're worried about another shutdown. And it sounds like the best suggestion how to calm those fears or prepare for another shutdown is to try and avoid the other shutdown and like encourage them to do a vaccination campaign and go to Steve's website, pull down some of the tools,
Yes.
maybe talk to, fill out that work site if they could get with some other businesses. It sounds like that might be, get people to get vaccinated if you're in if you're in a population that isn't very vaccinated. It sounds like
yeah.
that's
Vaccines are what will get us out. Vaccines are really going to be how we move to success.
And just to piggyback on that, I think what's really exciting is that we're talking here to a community of people who are working with trusted messengers who can really make a difference. The latest Kaiser Family Foundation tracking poll suggests that employers, businesses are the most trusted source of information about COVID-19 vaccines, second only to doctors. So you're talking to an audience here of people who can really make the case to everyday Americans that vaccines are safe and effective and something that they should consider. And they can actually not just share messages, but they can do something about it by offering paid time off, flexible scheduling, childcare, transportation support, small incentives. Those types of things, when combined with information, can get workers who are not yet vaccinated, get them across the finish line. And as I mentioned earlier, but I just really want to reinforce here, kids are going back to school. This is a lot of us are thinking that the pandemic, it feels like it's over, we're getting back to normal. But for kids and their parents, they are just beginning a whole new period of uncertainty when lots of eligible school children are not yet, or lots of school children are not yet eligible for vaccines, those under the age of 12. And then those over the age of 12, look, they don't, many of them are not yet vaccinated. And so this is a really, it's going to be an interesting school year. It's going to be, there's a lot of unknowns, but one way is that businesses can really support working families is to just make sure that workers who choose to get their kids vaccinated have the time off and the support that they need to do so.
Willie, how hard is it to the state to do one of those mobile things? I mean, I know our members are so focused on trying to help the businesses get online or to pivot their business or to help try and get a loan or other grant funding to, continue to stay open. How hard is it for the business? Like, let's say a business owner could get, send an email to all their neighbors and say, hey, how many people, sign up here if we get, right? A Google form, sign up here. If we get 100 names on the list, we can call the state, right? And then how hard from there after that?
It's really it's as simple as that. I mean, I know that that's not necessarily simple in all cases, but we use just a Survey Monkey form that gathers about 20 to 25 questions. It takes anywhere between 5 to 10 minutes to fill it out to the best of your ability. And we talk daily with a team of people that monitor those intake forms. So if it's something that we hit that threshold, then we'll reach out to the county or a provider in your area and You know, we've been able to turn around, obviously it's not ideal, but you know, we can turn around these kinds of events and sometimes as, you know, as quickly as 5 to 7 business days. So I really encourage people, if they're interested and think that there's an appetite where you are, to submit the form and see what happens. We'll tell you if it's not possible, and we'll recommend clinics within your area that have either appointments available or walk-up capabilities. So even if you just want to know what's in your area and what to tell your employees, we can help with some of that stuff. But it's really we wanted to provide this service as a easy way to get people in the door. So not that we can promise anything, I can't without knowing the details, but I really encourage anyone to check it out or share that with your network if there's interest.
Cool. I'm going to launch another poll just to get people and see how worried people are about the Delta variant.
I do have a question. Are there any updates or conversations about when the vaccine will become available for kids under 12, given, you know, the school year's coming and all of these things, right? Where are we with those type of updates on making it accessible to all ages?
Trudy, I'll defer to you. I'll defer to you.
Yeah, you know, we don't have an exact timeline yet. I think it's Pfizer that's really pushing to get that emergency use for 12 and under, and we're hoping fairly soon. I don't have an exact timeline yet though, unfortunately.
Okay, so basically I guess the recommendation would be, because I'm thinking of like my boyfriend's kids, his son is 12, but the youngest is 9. So one can get vaccinated, but the other can't, right? So like in those circumstances, I guess the recommendation is just to keep vaccinating when appropriate. I mean, masking up when appropriate, and just, okay.
Absolutely. So, and that's really why we have continued some of the masking requirements that we have, knowing that there's still a large proportion of our herd that either are just recently being eligible to be vaccinated or frankly still aren't eligible to be vaccinated. And so masking is going to be that second most important mitigation measure.
Other questions?
Any other questions? You have a threshold of a bunch of professionals here. You know, it's a great opportunity to ask the questions that you may have. Don't be shy.
and to put a finer point on it too, you know, Erika, Brandon, Vaughn, obviously all experts on the workforce side of things, on the labor side of things, on workplace safety. The regulations have changed obviously quite a bit since we last spoke in May, since the reopening. And so if anyone has any questions about what employers can and cannot do, what employees can and cannot do, just the general landscape as it relates to COVID-19 in the workplace, I would encourage you to ask, just because they are the leaders in this space.
Yeah,
I can't remember who sorry, Erika, I can't remember who is from Department of Labor, but what are the 2 things employers should not say, like that's going to get them into hot water with their their employees?
Vaughn Voyager is the senior deputy labor commissioner with the Labor Commissioner's Office within the Department of Industrial Relations. And then we also have Brandon Hart with Cal OSHA. So I would ask Vaughn to respond in terms of labor laws, which include information regarding paid sick leave, supplemental paid sick leave requirements, retaliation. You know, it's illegal to retaliate against workers who request to use their paid sick leave or supplemental paid sick leave, or who report an unsafe work condition. And then I would ask Brandon if you could weigh in as well from a workplace health and safety standpoint. So Vaughn, I'm going to ask you to take that question.
Certainly. Probably one of the main things for employers to know is you can't make an employee take sick leave, whether it's paid sick leave or supplemental paid sick leave, or even vacation for that matter. It has to be the employee's choice. That's probably the #1 thing to know. Another thing while listening to the presentation today is that employers can suggest that an employee go get their whether it's testing or shots, but if they're the ones requiring that employee get tested or shots, then they have to actually pay you specifically, time there and back, pay for the exam, etc. So if they're requiring it, that's one thing. If they're suggesting it, that's another.
Thanks.
Brandon, you want to weigh in with some safety?
Yeah, thank
Sure.
you, Vaughn.
Yeah, excellent points, Vaughn. With regards to safety and health for workers, what is it employers shouldn't do? They shouldn't discriminate against their employees for wanting to wear face coverings in the workplace. Even though the new revised ETS no longer requires employees to wear face coverings indoors when they're fully vaccinated or outdoors for any reason, employers, if employees still choose to desire to wear face coverings, they must be allowed to do so without retaliation. There's been many changes and updates in our ETS recently that took effect on June 17th as a result of trying to align it more closely with the CDC and CDPH guidance, particularly on face covering requirements, as Trudy had mentioned, and then also largely eliminating the physical distancing requirements, just so we can get back to reopening California safely. And that's largely because of, the vaccination rates there are so high in California. So there are many changes. I do want to just mention Cal OSHA has developed, along with DIR, several sets of guidance and frequently asked questions. I know Erika had posted those up in the chat room as well as I did as well. And I would encourage everyone to take a look at those. It'll help you navigate through our large regulation and hopefully better understand what it means to you as an employer, as far as what the employees are what their rights are and your obligations as an employer to open a safe and healthy workplace for your workers, in addition to patrons that may be visiting the workplaces which CDPH has jurisdiction over and that Trudy alluded to. So that would be my my suggestion.
In addition to that, I'd probably add that, on the retaliation piece of it is that if an employee asks for time off or takes time off, you can't retaliate against them. With regards to personal protective equipment, I'm not going to throw a lot of labor codes at you today, but Labor Code Section 6310, you can't retaliate against an employee who requests protective equipment, asks questions about safety protocols, seek assistance from Cal OSHA or anybody else, or ask questions or complain to their supervisors about protections. And they're under Labor Code Section 6311. In most cases, everybody needs to understand employers are responsible for their employees' safety on the job site. They always have been. That's not new. So anybody that has files a complaint or has any questions or refuse to perform work because something's not safe. I mean, it's always been that way, whether it was a ladder that wasn't safe or anything else, but now COVID kind of applies to Labor Code Section 6311. So essentially, employees are protected, and if there are retaliation claims, they can come directly through our offices through the Labor Commissioner's office.
Mm. And Vaughn, I think this one is for you too, is what can you do? How do you reprimand, punish, or how do you get an employee who's not vaccinated? They say they're not vaccinated and you're not requiring it and they choose not to wear a mask and you want them to wear a mask.
I'd probably leave that to DFEH, the Department of Employment and Housing, Fair Employment and Housing, to respond. I believe they're on the cutting edge of that. Brandon, I don't know if you've got a response to that, but as far as the Labor Commissioner's office goes, we don't have jurisdiction over disciplinary matters. But Brandon or the folks at DFEH could certainly better answer that question.
Yeah, thank you, Vaughn. With regards to an employee refusing to become vaccinated or receive their vaccination, employers are required to treat them, as an unvaccinated employee, same as those who choose not to state their vaccination status to their employer, and must require them to wear face coverings in the workplace when they're indoors. If there's some type of retaliatory action taken against an employee for failing to, get vaccinated, then that would be a DFEH situation, not a CalOSHA, a jurisdictional matter either.
Sure. And Brandon, what about if they're refusing not to wear a mask? Can they fire them, or can they say, well, or you can't come to work?
Well, the employer is required to implement their COVID-19 prevention program. And so as part of the emergency temporary standards, the employer is required to establish a program that must meet the minimum requirements of the regulation. And that indicates that employees who are unvaccinated or choose to not state their vaccination status must be treated as though they're unvaccinated and wear face coverings when indoors. So if the employee fails to follow the protocols or the procedures, then the employer can take action against that particular employee. They're to try to find other methods to mitigate the risk to those employees within the workplace. And so if you have an employee who's creating a hazard, then an employer is required to address that through their written policies.
Okay, so they have to have a written policy to figure out what happens after that.
Yeah, the standard does require them to establish and implement an effective COVID-19 prevention plan. And in that plan, it will address the issue of face coverings indoors.
Okay.
And you got to treat all employees the same. If you've got one policy for the folks that have been vaccinated and one policy for the ones who haven't been, you have to have a consistent policy for the ones that have and a consistent policy for the ones that haven't. So you can't say, hey, listen, how come Bob doesn't have to wear one? He hasn't been vaccinated, but Bill does. So that's the one thing that should also be noted, because that could open you up for a retaliation claim.
Got it. Does that help, Amanda? I hope that helps. I think Stephen had to go. He had a hard stop, so I will thank him off the air. Can you guys, if there's any last question, can we take one more question? Anybody has one? If not, it's 3:01.
I would just add that if you are advised by an employee that they feel that they caught COVID-19 at work, it's really important that you just as any other work-related illness or injury, that you have them fill out a workers' compensation claim form and take them through the process, working with your insurer or third-party administrator. It's important that you handle that appropriately so that the employee can be considered for all of the benefits to which they may be available. And we do have information about that as well on our safe reopening FAQs that I included in the chat.
And one more question. When do you expect to have guidance on whether or not booster vaccinations will be needed? Anybody got a crystal ball?
I'd love to be able to say, it's that I've got a crystal ball, but I think we're gonna obviously be watching the CDC very closely in terms of booster vaccination and when that's going to be necessary.
Great. Well, Willie, I want to thank you and your entire the entire state of California, right? It seems like we have so many people on from California. But really, seriously, Brandon, Vaughn, Erika, it was good to see you again. Trudy, same to you. Nice to meet the two of you. Thanks for answering our questions. We're going to put this up on our website and send around the PowerPoint with all those resources. And I'm going to encourage people to do a Vax campaign for their clients. I think that would be really cool, actually. It's a little bit, And the business case is you got to stay open, right? That's the business case.
Yep.
Yeah. And if anyone has any questions on the form to submit to request support, or any of the communication materials, or honestly, anything that was covered today in the slide deck, Heidi, please feel free to have people email me. I can connect them to the right folks on our side.
Will do.
Yeah, we're open to those questions, by the way. If somebody thinks of a question later or whatever, and they just email you folks, and you can just slot it to me, and I'll make sure that we address it for something that we would be normally having jurisdiction over.
Great.
Awesome.
That's
Thank
great.
you.
Thank you for being such a great resource and to our small business partners. And thanks everyone. We'll see you next time. Have a good July.
Thank you.
We'll
Thank
see
you all.
in August.
Thank you for having us.
Take care.